You look in the mirror every morning and you see it. That puffiness under your eyes that was not there 10 years ago, maybe 5 years ago. You have learned to expect it. You have made peace with it, the way you make peace with a lot of things after 60, by filing it under the category of things that just happen when you get older. The skin changes. The face changes. You buy a different eye cream. You sleep an extra hour and see if it helps. Sometimes it does, a little. Sometimes it does not. And you chalk it up to age and move on with your day, because that is what most people do with the symptoms that do not hurt, that do not interfere with function, that just quietly show up in the mirror and refuse to leave. But here is what nobody has told you, and what this video is going to change right now. That puffiness is not your skin aging. That swelling under your eyes, particularly when it shows up consistently in the morning after a night of adequate sleep and then partially fades through the day, is one of the most specific and most routinely overlooked warning signals that your kidneys are sending you from somewhere deep inside your body where you cannot see them and where nothing hurts yet. The kidneys do not hurt when they are struggling. That is the most important and most dangerous thing about them. Unlike a heart under strain, which eventually makes its distress known through the chest and the left arm, and the breathlessness that cannot be ignored. Unlike a liver in trouble, which eventually swells the abdomen in ways that demand attention. The kidneys decline quietly. They lose function gradually, in increments so small that no single week looks dramatically different from the one before. They send signals, but the signals look ordinary. They look like fatigue. They look like having to get up once at night to use the bathroom. They look like ankles that are a little swollen by evening. And they look like eyes that are puffy in the morning in a way that everyone around you and everyone in the mirror has taught you to accept as an inevitable feature of getting older. It is not aging. And understanding the difference between what aging actually does to the skin around your eyes and what kidney dysfunction does to the tissue in the same area may be one of the most important distinctions you ever make about your own health. If you want the kind of medical clarity that changes how you read your own body, please hit like and subscribe right now. Dr. Victor Lang built this channel to be the place where the symptoms that get dismissed get properly explained, because the consequences of missing them are real and they are preventable when you have the right information early enough. Let us start with how the kidneys create puffiness around the eyes, because the mechanism is direct, specific, and completely different from what aging does to skin. The kidneys are responsible for filtering waste from your blood and maintaining precise fluid balance throughout the body. One of the primary ways they accomplish this fluid balance is through the regulation of proteins in the bloodstream, particularly a protein called albumin. Albumin is produced by the liver and circulates in your blood, and one of its critical functions is oncotic pressure. This is the force that keeps fluid inside your blood vessels rather than letting it leak out into the surrounding tissue. Think of albumin as the anchor that holds fluid where it belongs. As long as your albumin levels are adequate and your kidneys are managing protein appropriately, fluid stays inside the vessels where it is supposed to be. But when the kidneys are damaged or under chronic stress, the delicate filtration membranes inside them, the tiny structures called glomeruli that filter blood with extraordinary precision, begin to leak. Proteins that should be retained in the bloodstream begin to spill into the urine. This is called proteinuria, and it is one of the earliest and most clinically significant signs of kidney dysfunction. As protein leaks out through the kidneys, blood albumin levels drop, and as albumin drops, oncotic pressure drops with it. Fluid that should stay inside the blood vessels begins to seep out into the surrounding tissue. It gravitates toward the areas of lowest resistance and highest tissue compliance. And around the eyes, where the skin is the thinnest and most loosely attached in the entire body, fluid accumulates with particular ease. The result is exactly what you see in the mirror every morning. Puffiness under and around the eyes that is worst after lying flat overnight, when fluid redistributes evenly, and that partially decreases through the day as movement and gravity pull some of it elsewhere. This type of swelling has a medical name. It is called periorbital edema, meaning edema, which is fluid accumulation in the tissue, specifically around the orbit, which is the eye socket, and periorbital edema that follows this specific pattern, worse in the morning, partially improving through the day, persisting over weeks or months, in a person over 50 or 60 with no obvious allergic cause, is one of the most consistent clinical presentations of nephrotic syndrome, the condition in which kidney damage causes significant protein loss in the urine. What makes this so urgent is that nephrotic syndrome is rarely the beginning of the kidney problem. By the time protein loss is significant enough to cause visible periorbital edema, meaningful kidney damage has already accumulated. The question is not whether to pay attention. The question is how much of the filtration capacity that remains can be protected by acting now rather than later. The difficulty is that periorbital edema looks so much like other things. Allergies cause puffy eyes, salt-heavy meals cause puffy eyes, poor sleep causes puffy eyes, aging itself causes some degree of structural change around the eyes as the fat pads shift and the skin loses elasticity. So how do you distinguish kidney-related morning puffiness from the ordinary variety? There are several specific characteristics that, when they appear together, point strongly toward a kidney origin rather than a benign one. The first is persistence. Allergy-related puffiness fluctuates with exposure. Salt-related puffiness fluctuates with diet. Kidney-related puffiness is consistent. It shows up every morning or nearly every morning, regardless of what you ate, regardless of your allergy exposure, regardless of whether you slept well or poorly. The second characteristic is the morning predominance and partial daytime improvement. This pattern tracks with fluid redistribution during sleep and is very specific to dependent edema driven by oncotic pressure changes. The third is the presence of other kidney signals that most people also dismiss as ordinary. Foamy or bubbly urine is one of the most significant. When protein spills into the urine, it changes its surface tension and causes it to foam persistently, the way soapy water foams. This is not the temporary foam from urinating with force. It is foam that sits and lingers for a minute or more after the urine hits the water. Seeing this along with persistent morning eye puffiness is a combination that warrants immediate medical evaluation. Full stop. Not watchful waiting. Not trying a different diet for a month. A visit to a physician and a urine protein test, which is simple, inexpensive, and can be completed within a day. Other accompanying signals of kidney origin include fatigue that feels deeper than normal tiredness, a kind of bone-level exhaustion that does not respond to adequate sleep, decreased urine output or changes in urinary frequency that cannot be explained by fluid intake, swelling in the ankles and feet, particularly toward the end of the day, that was not present a year or two ago, a persistent puffiness in the face more broadly, not just under the eyes, and occasionally a foamy quality to the urine that appears consistently rather than intermittently. None of these in complete isolation demands urgent panic. But the pattern, and particularly the pattern centered on that consistent morning puffiness around the eyes, is the kidney's way of communicating something that the clinical numbers may not yet be screaming. Because here is the sobering truth about kidney disease and lab values. Creatinine, the most common marker of kidney function in standard blood tests, does not rise into the clearly abnormal range until kidney function has declined by roughly 50%. By the time your creatinine looks alarming to your doctor, you may have already lost half of your filtration capacity, silently, over years during which the only visible signal was sitting in the mirror every morning, being blamed on age. This is the gap that costs people decades of kidney function they did not have to lose. The gap between what standard testing catches and when it catches it, and the early symptoms that were visible and present and dismissible for years before the numbers crossed a threshold. Filling that gap with knowledge, with the specific understanding of what morning periorbital edema actually signals and when it should be acted on, is not alarmism. It is the most practical form of health literacy available, and it is exactly what this conversation is for. Now let us talk about what else may be happening in the kidneys that produces this kind of fluid imbalance, because nephrotic syndrome from glomerular damage is one cause, but it is not the only one. Diabetic nephropathy, kidney damage caused by chronically elevated blood sugar, follows a progression that includes proteinuria and the same oncotic pressure loss that causes periorbital edema, and it is the leading cause of chronic kidney disease in the United States. Hypertensive nephropathy, kidney damage driven by chronic high blood pressure, damaging the delicate vessels inside the nephrons, is the second leading cause. Both conditions progress slowly and silently for years before they produce dramatic symptoms. Both produce the same early pattern of protein loss, albumin reduction, fluid shifting, and morning eye puffiness that gets explained away as age. And both are conditions in which early detection and management dramatically changes the long-term outcome, while late detection, after the creatinine finally rises and the numbers look alarming, means managing decline rather than preventing it. There is also a category of medication-related kidney damage that deserves direct attention because it is both common and consistently underappreciated as a cause of early kidney dysfunction in people over 60. Long-term use of over-the-counter pain medications, particularly NSAIDs like ibuprofen and naproxen, causes measurable reduction in kidney function in a meaningful percentage of people who use them regularly. These medications work in part by constricting the blood vessels that supply the kidneys, and chronic constriction causes the same kind of nephron damage that eventually leads to protein leakage and fluid imbalance. People who have been taking ibuprofen daily for joint pain for years, who have been dismissing their morning eye puffiness as skin aging, may be looking at a pharmacological kidney injury that is entirely real and entirely addressable if it is recognized in time to change the pattern. Similarly, certain supplements consumed in high doses, including vitamin D, vitamin C, and some herbal preparations, can stress kidney filtration when used chronically at the high end of the dosing range. And this is information that is almost never communicated alongside the wellness messaging that promotes these supplements as broadly beneficial. So what should you do with this information right now, today, in the practical reality of your life? The first step is the simplest and most important. Look honestly at the puffiness, not the puffiness that comes after a poor sleep or a salty dinner and is gone by 10 in the morning. The puffiness that is there, Monday, Tuesday, Wednesday, Thursday, every morning or most mornings, regardless of sleep and diet variation. If that is what you have been seeing, make an appointment with your physician specifically to discuss it. Ask for a urine protein test, also called a urine albumin to creatinine ratio, or a spot urine protein test. Ask for a comprehensive metabolic panel that includes creatinine and estimated GFR, your estimated glomerular filtration rate, which is the most complete picture of kidney function available on standard blood work. These tests are standard, routine, inexpensive, and available everywhere. The gap between having them and not having them is entirely a matter of knowing to ask. The second practical step is to look at your medication and supplement use with honest eyes. If you are using NSAIDs regularly for pain management, discuss alternatives with your physician that carry less kidney burden. Acetaminophen, used appropriately, is significantly gentler on kidney function. Topical anti-inflammatory preparations avoid the systemic kidney exposure of oral NSAIDs. Physical therapy, movement protocols, and other non-pharmacological approaches to chronic pain management may offer the ability to reduce NSAID dependence while protecting kidney function over the long term. The third step is dietary, and it is specifically targeted at reducing the filtration burden on kidneys that may already be under strain. Reducing sodium intake meaningfully reduces the fluid retention that compounds the edema from oncotic pressure loss. Moderating high oxalate foods, as we have discussed in other contexts, reduces the crystalline burden on kidneys that may have compromised filtration. Ensuring adequate hydration through the day without overloading any single period keeps blood adequately dilute and makes the kidneys' filtration work mechanically easier. And being thoughtful about protein intake, keeping it in the moderate range rather than aggressively high, reduces the nitrogen waste load that damaged nephrons are less capable of managing efficiently. The larger truth sitting underneath everything we have talked about today is this: your body is not random. The signals it sends are not decorations. The puffiness in the mirror every morning was never just your face getting older. It was your kidneys finding the one place in your body where the consequences of their struggle would be visible, where you would look every day and have the opportunity to see what was happening beneath the surface. They sent the signal in the only language they had. The question has always been whether anyone would teach you to read it. You can read it now, and what you do with that reading, whether you make the appointment, ask for the test, look honestly at the pattern you have been normalizing, that is where the trajectory changes. Not after a diagnosis that arrives too late to prevent the decline that preceded it. Now, while the window is open and the kidneys are asking for exactly the kind of attention they deserve. Tell me in the comments whether this is something you have been living with and dismissing. Tell me whether this is the first time anyone connected your morning eye puffiness to something your kidneys might be doing. Your experience matters here because the person reading your comment tomorrow may be in exactly the same place you were before watching this video, and your words might be what moves them to make the call that changes their outcome. And please share this with someone you love who is over 60 and dealing with the same thing they have been calling aging. Because the difference between knowing this and not knowing it is not just information. It is years of kidney function that do not have to be lost. The mirror shows you more than you think it does. The question is whether you know how to look.